Very warm welcome to this session where we'll look at diaphragmatic breathing for healthy outcomes, be it for chronic conditions, and we'll briefly look at diaphragmatic breathing in relation to sports and recovery. We'll also look at the research and the evidence that provides support for the use of diaphragmatic breathing in healthcare and in sports recovery. We'll look at the pathways, just some of them, the mechanisms by which taking slow breaths can be beneficial. I will introduce you very briefly to psychoneuroimmunology and its importance and its framework for looking at diaphragmatic breathing. And then I will take you through a slow breathing session for you to experience, and there'll also be the recording should you want to listen to it again. I would like to emphasize that this is a very brief introduction, to whet your appetite for more about using diaphragmatic breathing in sports and in healthcare, and looking more deeply, hopefully, at psychoneuroimmunology. So, of the 11 body systems, respiration is one. And respiration occurs through the autonomic nervous system. It is unconscious. We do not consciously consider each breath we take. Unusually, for most other bodily systems, respiration, while autonomic, can also be controlled. We can control our breath, as many people do. Singers, people who sing, deep sea divers, yoga teachers or practices of yoga, musicians, we can control our breathing, and we can control it under the framework of classical conditioning. That with repeated practice, with pairing it with, mainly with a regular practice, we can voluntarily change our breathing. I sometimes give you resources. You will receive these PowerPoints, and you can look up this YouTube clip looking at the basic mechanism of respiration. When I teach diaphragmatic breathing as a therapeutic intervention, what I teach initially is the very basic core essence of biomechanical breath, of breathing as we are supposed to biomechanically. So this is a nice, quick little YouTube clip that you can watch. So the importance of respiration is obvious when we look at cells. We have over, the literature says, up to 70 trillion cells in each human being. And we can probably best consider the importance of oxygen for each and every one of these miracles that is a cell. Ribosomes, some of the organelles, ribosomes produce proteins essential for almost every biological function. The membrane secures and regulates what can enter and what can leave the cell. And within the nucleus, within the chromosomes, is the DNA, which is constantly sending out messages. And the research now is even so detailed and sophisticated that it can look at what certain lifestyle changes, what certain relaxation techniques, what diaphragmatic breathing can do at a DNA expression level. For example, some of the research looking at neuroscience of breathing, and this is a review, it's not a randomized controlled trial, it's a review of the literature that demonstrates that our rate and rhythm of breathing, our patterns of respiration, impact and affect our emotions and our cognition, and conversely, how emotions can and do affect our respiration and our breathing. So breathing is essential, as we know. And I'm just going to go back to this to talk about how important oxygen is for each and every cell. And the best possible way to talk about that is to describe that the average human being with water can survive without food for up to 40 days. The average human being can survive up to 4 days with no water. And the average human being can survive without oxygen for 4 minutes approximately. So there is a really good example of primary, secondary, and tertiary needs for each and every one of our possibly 70 trillion cells. Primary, secondary, tertiary is oxygen, water, and nutrition. All right, so an example of literature is looking at the relationship between emotions and respiration, the rate and patterns and rhythms of breathing, and their links to different emotional states. In this review, they talk about 6 different pathways of recognized, neurological pathways going to different parts of the brain, be it the prefrontal cortex or the amygdala or the hypothalamus, and how they affect different cognitive and emotional functioning. The research looks at connectivity. So it's the firing of different neurons that may and do occur over different parts of the brain, and how the connectivity operates within an organized network, a pattern. The research has also demonstrated that all these complexities of complex neurological processes operate via the respiration instigator, what drives the inspiratory rhythm. And it is known now, recognized as the breathing central pattern generator, BCPG, and it's deep in the brain and it initiates our breathing patterns. It drives our respiration. So again, an introduction into some of the complexities of the research into respiration that leads to different research in what regulating and taking slower breaths can do for us. So there's definitely a multitude of neurological links and pathways between respiration and the brain, cognition, and emotion. What we also know is that there is a reverse causality, that emotions and what we think, our cognition, can affect our respiration, our breathing rates, and conversely, our breathing rates can affect our thoughts and emotions. And since we know that we can control and regulate our respiration, it has been used and researched and demonstrated to be efficacious to reduce pain, to enhance relaxation and decrease the impact of distress. It can reduce panic attacks. So there's this link between the breath and emotional and cognitive states. The prefrontal cortex is largely involved with cognition and emotion. The vagus nerve, I will talk about vagal nerve later in this presentation, and how it can innervate different parts of the brain, and in particular, or initially, the amygdala and the hippocampus, horseshoe. And then research also looks at different respiratory rates and its impact on mood disorders like anxiety, how we may feel calmer. It can decrease depression, enhanced sleep, very important for athletes and for recovery, and even increase motor skills. Again, that's a brief taste, an introduction to some of the research that looks at what are the pathways by which respiration can impact emotions and cognition, and vice versa. And those pathways are neurological. They're also endocrinological and immunological. So let's have a look at psychoneuroimmunology, PNI. At its simplest definition, PNI is studies the interactions and communications between the nervous, the endocrine, and the immune systems. So there is no doubt now in our understanding that all 11 bodily systems impact each other. Nothing operates in isolation. PNI looks specifically at the interrelationships, the communications, the messages between the nervous, endocrine, and immune systems. When we break it down and look at the nervous system, what is the nervous system? It's split into two: the central nervous system, which is made up of the brain and the spinal cord, and the peripheral nervous system, which is then split into somatic, what we can control, and autonomic, what happens without us consciously dictating. Excuse me. When we look at the central nervous system, the brain and the spinal cord, the brain is the primary organ responsible for cognition. So our thoughts, our memories, our ability to analyze, to think, to remember, and so much more. So then there's the peripheral nervous system that enables movement, metabolic function, and so much more. The endocrine system, the chemical messengers of the endocrine system are hormones. Hormones, endocrine, same thing. Hormones are greatly involved also in metabolic function, and also involved in our emotional state, our feelings. Very briefly, our immune system is the system that keeps us healthy to the best of our ability, that can combat. It's often an analogy is used as in defense. It's a defense mechanism. It keeps us healthy. We have attackers. We have cells that destroy non-wanted, unwanted cells. So our immune system is the system that to the best of its ability keeps us safe from infections and injuries. So if we were to, what I just said about these three systems, if we were to put that into real layman's terms, it would be that what we think and what we feel affects our health and well-being. And conversely, and in any combination, what we feel affects our thoughts and our health. And our health, how healthy we are, how sick we are, affects our emotional states, and so much more, and our cognitive states. So PNI is the science that investigates the links between our psychological and physical health, between our mental and emotional states, and our biological well-being. It is what the literature is, the term that the literature is now using is mind-body health, mind-body science. Let's take it a little bit further. Again, this is a brief introduction. So PNI, psychoneuroimmunology, is a science that investigates biological processes and mechanisms and pathways that affect our psychological factors. And it looks at how those psychological factors, so cognitive processes, how those cognitive processes impact our immune function, our health and well-being. And I'll keep going. Psychological factors, we know the research time and time again over the last 30, 40, 50 years has shown that different psychological factors can impact the onset of a condition or disease, the incidence, how often it happens within a population of a particular condition or disease, the progression, how quickly does it deteriorate, or how well does it stabilize. The progression of the condition or disease is affected by our psychological factors and our mental health. And so too, the degree to which a treatment, a rehabilitation is effective depends on psychological states. So there's a plethora, there's a strong body of research that demonstrates these. The reverse also is the case, that our immune health, our immune function, the health of our immune system impacts our cognition, our emotional states, our outward behavior. And outward behavior is it's the outward demonstration of cognition and emotion, and our emotional factors. So immune responses affect all of this. We know this through what is called sickness behavior. So immune molecules called cytokines reduce our capacity for clear cognition, for stable emotion, for rational behavior when we have an infection, the flu or COVID. We can't think as clearly. We need to sleep more. We're not interested in food. So immune function affects our nervous system and our endocrine system. It is all done, all this amazing interactions and communications that P&I studies is done from cell to cell. So simplistically, here is a cell membrane. This is the cytoplasm with all the organelles. And here is a receptor, which is like a satellite dish. And the satellite dishes communicate with others that send messages. The receptors of one cell, the receptors of one cell communicate via molecules to another cell through the membrane and into the cytoplasm of the other cell. And there are receptors. The research has identified up to 30 different types of immune receptors. If this is a T cell, an immune cell, that there can be 30 different types of immune receptors to pick up messages from hormones, the endocrine system, to pick up messages sent by neurotransmitters of the nervous system. And there's this complex interaction of communication between cells. And I do believe that you could study what happens in here for decades. All right, so these biochemical messages, just to review how these three systems talk to each other, are via the biochemical messages, neurotransmitters and neuropeptides such as adrenaline, serotonin, and dopamine. And I will point out, because I'm not sure what happens in Europe, adrenaline is the same as epinephrine. It depends whether you're using terminology that is American or British Australian. The endocrine system communicates via its hormones. The biochemical messengers are the hormones. For example, and there are, of course, many, oxytocin, cortisol, the different growth hormones. And they all affect each other. There's a host of different immune cells, both innate and acquired or adapted, such as interleukins, interferons, the tumor necrosis factors. These are all different cytokines, which are the chemical messengers of the immune system. And so what do all these messengers do? They tell what the body should be doing. Is it stimulatory? Do we need more of something? Have they stepped on a rusty nail and they need the inflammatory process to occur? Then it's stimulating the immune system. Does it need to be inhibited? We have too much. We need to reduce the amount. Or is it simply a modulation, which it all is, to adapt to the environment of the body at that moment? This happens 24 hours a day at a cellular, a molecular, and genetic expression level. Let's look now at the vagal nerve or the vagus nerve, and look at it a little closer as one of the mechanisms, one of the pathways by which diaphragmatic breathing can impact and does impact our nervous system, our neurological functioning, like cognition, our endocrine system, our hormones, our emotional states and metabolism, and our immunity, our ability to remain as healthy as possible. The vagal nerve, and I've looked up what is the difference between vagus and vagal in English. There are different ideas. Some people use them interchangeably. I'm not going to fuss too much about it. What we do know is that it's originally Latin for meandering, wandering through. So in English, a vagabond is someone without a home and goes to different places. There are 10 cranial nerves, and the vagus nerve is the 10th. It is also the longest. It has both motor fibers from the brain to the body, to the outskirts, to the periphery, and sensory fibers going bottom to top. It passes through 3 body systems. So it's a significant nerve because it passes through the abdominal cavity, the thoracic cavity, and up to the top of the cervical spine. So it has a very wide distribution of any nerve throughout important organs in the body. Here it is. What's in yellow is the vagus nerve, the different fibers of the vagus nerve. What is so important in relation to the vagal nerve and diaphragmatic breathing is that it is the primary nerve of the parasympathetic nervous system. The parasympathetic nervous system is responsible for our calm, restorative, recovery pathway. So the vagus nerve is the main nerve of the parasympathetic nervous response. Let's have a look at it. This is a great diagram to give you an idea of how breathing and the vagus nerve are linked. Here's the diaphragm. This diaphragm is at rest, okay? The vagus nerve passes through it, as other parts of the body do. And they go to the abdomen, the heart, the colon, the adrenals, the fibers of the vagus nerve goes to major organs of the body. And then it goes right up, vagus nerve here, to the top of the cervical spine at the base of the skull. I would like you to remember this diagram for later on when we do practical diaphragmatic breathing. All right. When we use the diaphragm to take a slow breath, the diaphragm contracts and moves down. It moves down, and it would move down to about there. So it directly stimulates parts of the vagus nerve. There are many connections between the nervous system and the immune system. The vagus nerve is one of them, how it connects the brain to the immune system. So here we have the adrenal gland. So let's say we see a stressor, a car accident about to happen. Actually, that's not the best example. Let's say you are undergoing, you have undergone a particular stress for a long time. So in the case of an athlete, they have been training for about as long as they normally train. The cortisol releasing factor stimulates adrenocorticotropic hormone from the hypothalamus, which is part of the endocrine system embedded in the brain, which then goes to the anterior pituitary gland to release the ACTH, which goes and stimulates the adrenal cortex, the outside of the adrenal gland. So this is a major organ of the endocrine system. And from the cortex, cortisone, the corticosteroids, cortisone, corticosterones are released. So the stress hormones. And they then have a positive and negative feedback loop, biofeedback loop with immune inflammatory processes. So directly involved in inflammation, which then goes through the vagus nerve, vagant fibers, and goes back up to the nervous system. And this is lipopolysaccharides, which help to transmit necessary messages for the inflammatory process. So again, a brief introduction about how the brain and immune system, how the nervous system and immune system talk to each other. And it's often through the stress pathways, such as this one. The research also shows us that when the vagus nerve is not stimulated, when it does not function enough, when there's what they call low vagal nerve activity, there is a direct relationship that can and does lead to disease. Now that's a big call. But the research shows that low vagal nerve activity, when the vagus nerve and its fibers are not stimulated enough, are not active enough, it leads to disease. Low vagal nerve activity has been shown in the research involved in directly leading to cardiovascular disease, different cancers, different dementias, and Alzheimer's. If you're interested in this area work, There's a Professor Gidron, who is one of the many researchers and clinicians in this area. He too is passionate about psychoneuroimmunology. And this article, I won't go into too much detail, looks at factors that contribute to low vagal nerve activity. Okay, so when we are constantly aroused in the sympathetic nervous system, when we are chronically aroused, then that can contribute to low vagus nerve activity. So can chronic inflammation, so can cellular oxidative stress. So again, what I'm trying to show you in a very brief way is the interrelationships between the nervous, endocrine, and immune systems. What the research goes on to show is that there is, when there is adequate or good vagal nerve activity, this in turn, so when there's a firing and stimulation of the vagus nerve, and one of the ways that occurs is by taking slow, deep breaths, then there are many outcomes to that, one of them being the release of calming neurotransmitters. So the nervous system releases acetylcholine, which gives us a sense of calm, oxytocin, which enables us to feel aligned or in communication with people, serotonin. So neurotransmitters are released that are part of the parasympathetic nervous system. It also, so by stimulating the vagus nerve, part of the nervous system, it also triggers anti-inflammatory cytokines or messengers, and affects the hypothalamic pituitary adrenal pathway, which is the second of the two stress response pathways. But in addition to all of that, good vagal nerve activity, which you can get from taking slow, deep breaths, moderates, enables the immune system to do what it's supposed to do, to be on surveillance and look out and guard us against precursors or tumor markers or polyps or anything that shouldn't be there. And this in turn reduces the risk of diseases. The research is solid. And this is the puzzle pieces of research to support that diaphragmatic breathing stimulates the parasympathetic nervous system via the vagus nerve, which elicits a calming, homeostatic state and reduces the risk of major injuries. A little bit more about this. Vagal pathways go to the parasympathetic nervous system, which includes a very deep part of our brain, the anterior cingulate. And the anterior cingulate is involved in very sophisticated cognitive functioning, higher order cognitive processes like evaluation, decision-making, judgment, emotional regulations is very important for psychologists. And also our heightened fear state in the amygdala is inhibited, can be inhibited. So, and then the anterior cingulate is divided into different areas, which you can have a look at. Is this not all involved in what an athlete does and what's so important in rehabilitation and recovery? Are they going to evaluate, are they going to be able to make that judgment call, whatever it is? Yes, rest for another day, stretch and strengthen equally, whatever, can they make a decision about their recovery? Are they able to control the emotions, the range of emotions of disappointment from injury, from optimism in recovery. All of this operates deep in the brain and is affected by our respiration and affects our respiration. Okay, let's look. I'm only going to spend a little bit of time looking specifically at sports. This is an introduction to an area of research and how it can be very specific to looking at diaphragmatic breathing as a preventative and therapeutic intervention for sports people. Here's a journal, and it's recent, 2015. It's, recent is arbitrary in research. It's still a very relevant piece of research where they looked at the outcomes of different breathing exercises, mainly taking a slower, deeper breath. It obviously, it does increase lung volume. It helps to eliminate the metabolic waste and the secretions that need to be eliminated. It improves the gaseous exchange. It certainly conditions us to be able to control the breath. And psychologically, having control over something is fundamental for mental health. So an athlete can control their recovery by regularly taking slow breaths. It increases exercise capacity. It reduces blood pressure. It reduces the stress response and the distress experienced at a time of sports recovery. And diaphragmatic breathing, slow breathing has been used in pain management even before the very sophisticated PNI research was available. It clinically works. It works clinically. This looks at tennis in particular. There's a link that you can, if you're interested in the psychoneuroimmunological framework in tennis. They talk about PNI as offering a holistic and an integrative perspective, which is exactly what it does, for the athlete in order to perform better. It talks about what is now known as integrative medicine, lifestyle medicine, how our psychological well-being, how our diet and nutrition, how our sleep, how our exercise, how our relaxation and stress management, how our social support all impact the three systems, the neurological, endocrinological, and immunological processes. And because we know emotions, thoughts, and health are linked, you are the experts in understanding that the emotional state of the athlete, of the sports person, is important to also improve performance outcomes. Emotions like loneliness and frustration are experienced, and something as simple as diaphragmatic breathing, we'll look at guided imagery in the second session, how these can help enhance, and particularly guided imagery, how the evidence is that these techniques can enhance performance. Here's another article. What is the connection between breathing and sports performance? It is, again, a review, and it demonstrates that with a consistent and a controlled and a regular practice, and they're my two key words, regular practice, of the respiratory, of breathing. It assists in oxygen supply. It helps to eliminate the metabolic waste at a cellular level. It regulates heart rate because the vagus nerve, and this is only one mechanism, the vagus nerve goes directly to the heart. It improves our neurological prefrontal cortex and other parts of the brain, higher order thinking, concentration, focus. it's all linked. So all essential for peak performance. Briefly, a summary of what we've discussed so far is relaxation techniques, lifestyle medicine techniques, such as diaphragmatic breathing, are both preventative and therapeutic. And that's so important. That's significant. That when done regularly, these techniques can be preventative in a fight against infection or in an injury. And then if an injury or infection occurs, it can help recovery and be therapeutic. Most of my teaching is looking at diaphragmatic breathing for chronic conditions. Athletes do have chronic conditions, scar tissue, a certain block in mentality, whatever it may be. But diaphragmatic breathing is also beneficial in sports recovery and rehab. There's a strong body of evidence in randomized controlled trials, and there are reviews that support breathing and diaphragmatic breathing techniques for a whole host of health outcomes. And the research looks at a cellular, molecular level, at chromosomal levels. They look at the telomeres on the ends of chromosomes, genetic expression changes in relaxation compared to times of stress. The research is so sophisticated now about the neuroscience of breathing and its impact on behavior, which sports is, performance is a behavior. So we're knowing and understanding more and more. Another important area of research looks at how techniques like these, like diaphragmatic breathing, is cost-effective to the healthcare budget or to the training budget. Okay, there's good, strong evidence, such as in cardiac surgery, those who did diaphragmatic breathing pre and post surgery left hospital earlier than those who had the same surgery without the relaxation technique. And that's a saving of a lot of money. And there's always opportunities for further research. So we are now going to have a look at the practical side of diaphragmatic breathing. And I will pause now and be back immediately. Welcome back. That was a lot of the science and a little bit of the science behind why and how diaphragmatic breathing can be therapeutic. Let's have a look at it. Let's have a look at diaphragmatic breathing more broadly. We know it's evidence-based, and I've given you a taste of that. It's something that athletes and that we can do for ourselves. It's certainly non-pharmacological, non-invasive. It is cost-effective. It's also, once you've learned to do it and you're practicing it for yourself, or your team or your athletes are practicing it for themselves, which gives us control over our health and well-being. And it's portable. They can do it on the field, they can do it at home, they can do it while listening to the strategies. You can take these slow, deep breaths almost any time. Now, to look at how to take slow, deep breaths, I talk about the torso. That is everything from below the clavicle, the collarbone, to the pubic bone, symphysis pubis, which is here. So that is the torso. It does not involve the upper fibers of the trapezius or the shoulders, and it follows the curve of the iliac spine and the symphysis pubis. That's the torso. This is a good diagram to demonstrate what happens during a slow breath. So this is the diaphragm, a diagram of the diaphragm, the big muscle that is principally involved in taking a slow, deep breath. It is relaxed, and as we inhale, the diaphragm moves down. Now, it doesn't actually flatten like this. It goes to about there, but from here. So it moves down and flattens a bit. And it does that to allow for greater lung capacity. So that's what a diaphragmatic breath is. And we're working from the collarbone through to the symphysis pubis, the whole torso. When we exhale, when we breathe out, the opposite occurs. The diaphragm relaxes and goes back to the dome shape. That helps to eliminate the waste and release the carbon dioxide, and the lungs become smaller. So when we look at the torso gets bigger three-dimensionally when we inhale in an ideal big breath, and then the torso gets smaller as we exhale. And so now I want to give you the details of being prepared to use diaphragmatic breathing initially, to become accustomed to it in order to practice it. So these are sort of these are the clinical considerations when using diaphragmatic breathing, but I'm giving this to you to use for yourself. Try to be, whether you're seated or lying down. So this is more for relaxation. To be as comfortable as possible, make sure that there's no interruptions, and I should turn my phone off, which I didn't do. Which I will do quickly. I do think it's important to have water and be hydrated. You cannot relax when you're cold. So it's important to be warm enough, no interruptions. If you're lying down, have a pillow supporting under your arm and knee, under your head and knees, sitting up straight. When I sit, I use a lumbar roll to help support and keep straight. Now, it's really important that you know, when I take you through diaphragmatic breathing in a few minutes, and that you know, you can control your breath. So if you don't like the exercise, if you want to stop, you can do so at any time. If you want to open your eyes, you're welcome to close your eyes. You can move, you can scratch. So you don't need to be rigid. If there's the slight chance that you feel dizzy because you're oxygenating your neurons more than they're accustomed to, you can stop taking the slow breaths in. You can move. And what's very important to emphasize is that breathe slowly at your own pace. So if I am still saying inhale and you're exhaling, that's fine. You breathe at your own pace. It's important that you breathe slowly and smoothly. I use the image. So the next session is about guided imagery. Imagery is good, it's helpful. That when we inhale, our torso is like a balloon, and it expands as much as possible. And when we exhale, our torso is like a balloon emptying of air, and it gets smaller. And we do this slowly and as smoothly as we comfortably can. If you want to or when rather than if, when you want to practice this at home and you want to lie down, then this is a good position to be in, or simply put a pillow under your knees. Make sure that your spine is as straight as possible. So I'm now going to take you through a diaphragmatic breathing exercise. The beauty of recording is that you can stop and start as you like, and you can repeat it. So if you like and can benefit from this exercise, you can listen to it again. I'm now going to ask you to do these things. So you can stop the recording and be prepared. Make sure you're comfortable and warm and hydrated with as few interruptions possible. So sitting back in your chair or lying down, if you're comfortable to close your eyes, then do so. Your spine is as straight as possible. You're warm. And if you're seated, bringing your buttocks back in the chair, bringing your buttocks back in the chair, shoulders are down. If you're lying down, aware of your body on the couch or bed, closing your eyes when comfortable, and bringing your awareness to yourself. Bring your awareness to yourself and feel the weight of your body against the chair or the couch. It is typical and normal for thoughts to be darting around in our minds, but bring your awareness to your body and the weight of your body against the furniture. Bringing awareness to you in your room, closing your eyes when you're comfortable. And keep aware of the weight of your body touching the chair, couch. In your own time, allow yourself this time to allow other thoughts to drift away, to allow those thoughts to become a little further away and come back to the weight of your body, aware of the buttocks. See yourself almost from a bird's eye view. Notice your body on the furniture, your position. Aware of the weight of your body in your room. Allow other thoughts to move aside. And in your own time, always at your own pace, become aware of your breath, remaining the same without changing anything. Notice your breath. Aware of where it starts. Aware of where your breath goes. And in your own time, thinking of the balloon in your torso as you breathe in, slowly a little bigger. As you exhale, smaller. breathing at your own pace. Breathing in, expand. Exhale, smaller. Inhale like a balloon, bigger. Slowly release and exhale. Aware of your breath. Aware of getting a little bigger as you inhale. Exhale, smaller like a balloon. Allow other thoughts to slip away and become more aware of your breath. Focus on your breath, expand as you inhale. Exhale, smaller in the torso. In your own time, at your own pace, aware of getting bigger as you inhale, smaller as you exhale. Take 3 more slow breaths. Exhale slowly. Inhale, expand. Slow exhale. Slow breaths in your own time. After 3 slow breaths, allow your breath to fall effortlessly. No longer control the breath, let it fall automatically. And bring your awareness to how you feel now, allowing your eyes to stay closed if you're comfortable. Aware of your body, the weight of your body, aware of being in this room. Notice with your eyes closed how you feel, how you are inside mentally and emotionally. If you're comfortable keeping your eyes closed, bring your awareness to being in this room. If you need to, with your eyes closed, wiggle your toes, slowly, slowly bringing your awareness to the room, to the sounds outside the room. Gently place your hands over your eyes. And when you're ready, in your own time, slowly, slowly, looking down as you open your eyes behind your hands, in your own time, coming back. And because this is recorded, you can stop, you can take your time. That was 9 minutes from where to go. Just almost 10. And that was the first time that I've taken you through. Taking slow breaths is a skill, a technique, a practical skill, like learning to drive a car, like learning a new training schedule, like learning to put in a catheter. We're never great at it the first time. It requires regular practice. The advantage to having the recording is that you can listen to it again and you can practice it a few times. It is important, and I also recommend, and I'll talk about what I recommend, to have this image in mind. When I teach via Zoom, I do use the analogy of the balloon, and if I'm face-to-face, I give out balloons. It's a great way to remember what we're aiming to do. Biomechanically, if we slowly improve our capacity to enlarge, to get bigger throughout the torso, then we're using the diaphragm more and we're allowing more oxygen into our lungs, and all those benefits cascade at a biochemical level. And you can remember this when you exhale. At the end of the session, take note, if you want to listen to the recording professionally, then notice the change in rate and rhythm of my voice. Really important to tell people to be as comfortable as they like. You can open your eyes, you can move. Then slowly bringing your awareness to your body in this room, to your breath, and then to taking slower breaths. And then slowly, stretching if you want to. Wiggling your fingers and toes is a good one. I didn't this time, but you can rub your hands, palms together, more than the fingers, the palms. Place the palms over the eyes and looking down, slowly opening your eyes. That's a nice way. Never rush after relaxation. When you are ready, and I think this is a very brief introduction to using diaphragmatic breathing clinically. There's a lot more to consider. But the important things to consider when implementing or teaching diaphragmatic breathing to a sports person, to a patient, to a client, to family and friends, is the why, the how, and the when. The why is everything that I've given you a taste of. It's all the research, because it works, because we understand just some of the many mechanisms by which it works, because clinically we see the benefits. That's why to use it. The how is what I've given you a brief introduction to. How do you actually perform this well and correctly and effectively? The when is the frequency and the regularity. It's not the duration that's important, it's the regularity. Take 2 or 5 slow breaths once or twice a day, every day. That is how we gain the benefits. Be aware there's a slight possibility. I don't have the scope to talk about this more. It's simply, there are several reasons for it, but people may feel dizzy initially. That does subside. Always comfortably breathe at your own pace. correct that you're as comfortable but as well positioned as possible, that you should always keep an eye on the other person if you're taking them through diaphragmatic breathing, which is why I don't like recordings like this, because I can't keep an eye on you. And this is something that benefits people because they can do it for themselves. To summarize, my introduction to you about how psychoneuroimmunology is the science that supports integrative approaches in healthcare and in sports, performance, and rehab and recovery. The only way to benefit from it is to practice. It's the regularity of the practice that is so critical. Then, after regular practice, you develop a proficiency. And by developing that proficiency through regular practice, it starts to become efficacious and beneficial. And ultimately, after months and years, you develop an expertise. So I will leave you with my recommendation that for yourself, those of you who have attended this session, that you start to practice taking slow breaths. You start to practice 5 slow breaths once or twice a day over the next few days, weeks, and months. You're welcome to take more than 5 slow breaths, but if time dictates, 5 slow breaths twice a day, every day. We can condition ourselves to change, our breathing. And that's done through regular practice. Thank you for your interest in this endlessly fascinating area, which I'm always keen to discuss more. You can contact me through my email there, have a look at my website, and certainly get in touch with me through Robert. I'll be back for session 2 looking at guided imagery.